Hello, everyone. Dr. Nick Verma here with another edition of Things I Didn't Learn in Med School. Today, I want to talk about this lawsuit that came out from the U.S. Department of Justice against OhioHealth, which is a big hospital system in the Central Ohio region. Now, this is specific to the Ohio region, the Central Ohio region where I live and where I work, but this is a common trend that is occurring all across the United States. And it's a trend that you really should be paying attention to. What this lawsuit is showing is the anti-competitive healthcare contracts that increases costs for patients. You can see here that the lawsuit challenges the contracts and it limits the consumer's access to price information, but also restricting the access of care for these individuals. OhioHealth is a major hospital system here in the Central Ohio region. It employs, I think it's either the first or second biggest employer in the Columbus region. It also is a hundreds of millions of dollar company, an entity. Because of that, they can go around and buying up all the smaller hospitals in the region. They can buy up the smaller medical practices in the region, and they can, for better or worse word, make a monopoly on the healthcare system. Now, patients in this system will get stuck. They'll get stuck in the sense that they go to an OhioHealth physician, maybe their primary care, and maybe they need a specialist, a neurologist, an endocrinologist, a rheumatologist, nephrologist, what have you. And the wait times that they might have to go see one of these physicians can be 3 months, 6 months, 9 months, a year, more. And I've had many patients, even in the pain medicine world, come see me because they told me I couldn't get in to see them for another 3 to 5 months. And that is not a good sign for when patients need care, especially if they need emergent care. Say in my field, we have patients that might need physical therapy, might need some imaging, x-rays, MRIs. Well, if they're waiting 3 to 5 months and not getting that conservative care in that meantime, things are going to get worse and their pain's going to get worse. And we're delaying any treatment options because of that gatekeeper effect that these large hospital systems that is happening. Again, this is not special just to the Central Ohio region. I don't know why this is occurring right now, and it seems like because the Attorney General of Ohio filed the lawsuit, and you can see this just happened this week, February 20th. Today's the 26th. This video will be published on the 27th. It's part of the issue that we're seeing in the healthcare industry right now, and the issue that independent physicians are going up against. These hospital systems, they have the ability to go behind the scenes and negotiate contracts with the insurance companies. And these insurance companies have no other choice but to agree and work with them. So we get this little game that the hospital system complains about the insurance company complains about the hospital system, all while our healthcare prices continue to go up. And not only on the healthcare cost side, but also, as we know, our premiums for health insurance have gone up, our copays have gone up, our out-of-pocket deductibles have gone up. They're both sitting here pointing the finger at one another like that Spider-Man meme of them just pointing at one another. But the truth is they're in bed together and they're going against the consumer, which is the patients. And it's not right and it's not fair. And I urge you to take a look at this. This is why I'm so passionate about staying independent as long as I can, hopefully forever, and building something that's outside of the system. Because I know I can offer better care. And I know a lot of physicians feel the same way. Not always a better care, it's more affordable care. We know the same procedure that I do in my office is 3 to 5 times more than what it would be at surgery center, out of pocket patient pay. And that might even be more if you go to a hospital system and go get a procedure done with them. It's absolutely terrible. I don't know how we've gotten to this point, but people just keep accepting it. And that isn't a long term solution for our healthcare problems. The other big issue with this is because these hospital systems are so large and can employ so many people, and they can really market and give huge signing bonuses. Those employees that might be better served in the community are stuck in this system because of the high pay and the benefits. I know of several nurses and other employees that have quit big hospital systems because they were so fed up with how the administrative burden was limiting what they're supposed to do and want to do. I know of physicians that have left major hospital systems because of the same reason. A lot of those nurses came to work for me part time as they were transitioning to a more full time position. So I've had a lot of one on one conversations about the system. Patients, they aren't happy either. Waiting that amount of time to be seen by a specialist, or being ignored and not getting their questions answered in an appropriate amount of time. It's very, very difficult to see a future where this is not the norm. But I'm hopeful, and I'm working on my end to make sure that I can continue to provide care for patients in a safe and healthy manner by going outside of what this Ohio Health corporations are doing. Again, I want to reiterate that this is not unique to the Columbus area. This is actually happening nationwide, and I don't think people really understand what's going on. Just a couple weeks ago, I put out a video speaking of James Vanderbeek and his tragic battle with cancer, and how his family was in financial distress because of the radiation treatments, the follow up care, et cetera, et cetera. And for all intents and purposes, his family was more or less better off, well off, right? They weren't living in poverty. They weren't making minimum wage. They probably had some money saved away for these kind of things. They probably had really good health insurance. Now, just imagine those families out there that don't have those resources. And I think it talks about it here where the restrictions cause residents to pay more for lower quality health care. And the American families and consumers do deserve better. It'll be interesting to see where this goes. And I'm going to follow it pretty closely. I don't know if this is enough to make a change, a meaningful change anytime soon. But I do think it's something important for us all to keep an eye on and be aware of. And if you're really, really concerned about your health, you need to start considering who is the physician you're willing to go see. Are you picking someone that is going to fight for you and fight with you? Or is it okay for you just to be stuck in the system? I know for myself, whenever I need healthcare needs, I see who I can see on the outside of these systems because I know what these systems do. I know how much they gatekeep. I know how they limit care. And it's a message that's echoed across the US. I do want to say I don't blame any physician for working for one of these corporations, these medical industrial complex systems. I get it. The pay is great. The vacation's great. The benefits are great. I don't even blame any of the employees that work for them. It's hard to blame them because they're not the ones that are part of the system. It's the system that's above them. These C suite executives that have very few, if any, actual MDs that do actual patient care, MDs or DOs, that do any actual patient care, but they make all the decisions for us. And then on the other end, we know that the healthcare insurance companies are no better. They don't have patients' best interest at heart. They have shareholders, they have employees. They want to make as much money as possible. We need to start treating our healthcare system as it is, and we need to start fixing the problems involved. I hope you'll join me in this fight, in this educational purpose. I hope you spread this word to other individuals that might be struggling with this because it's important. And we need to start fixing the healthcare system. It not tomorrow, it should have happened 10 years ago. But now is the best time to start. As you can tell, I'm super passionate about this because it is the frustration that I see for myself and my patients, and I want to do better. I hope you guys found this useful. Please share, please subscribe, please like. If you have any questions, comments, please drop them below. And maybe that's something we talk about. What is the healthcare change that you'd like to see in the system? Until next time, I'll see you there. Bye.